Other numbers that you need to be aware of too for Georgia. If in fact we have a highly lethal virus like this H5N1 that particularly attacks the lower part of the lungs, where we have to deal with so-called ARDS, acute respiratory distress syndrome, where patients literally drown in their own fluids. Those types of cases require mechanical ventilation. Now, how many ventilators do we have on an average basis here in Georgia? 1,500. We anticipate 22,000 patients will need mechanical ventilation during the pandemic. 22,000. So the numbers there get rather frightening. We're doing a lot in terms of beginning to cache ventilators, and that's good. But we don't have people to man the ventilators. Just like we're not going to have enough nurses to take care of the patients. Staffing is going to be a horrendous issue for us. We expect 57,000 people to die in Georgia alone during the pandemic. This year we're purchasing 25,000 additional body bags. So the numbers become quite staggering for us. The value of this particular exercise today may be escaping some folks. Public health has a very frightening responsibility during pandemic as well as during other health emergencies. In the Georgia Emergency Operations Plan, public health has what's called the Emergency Support Function 8 primary lead responsibility. It's kind of scary because basically it says public health is responsible for assuring health and medical will still be there during any type of catastrophe. Not that we necessarily will be delivering it, but we're accountable for trying to see that the population has access to health care during disasters. My greatest worry is that with the numbers in Georgia that we're talking about being ill, the impact on the hospital and the medical systems could become, in fact, probably will become, absolutely overwhelming. And our job in public health is to guard against that. One of the most important things that we think that we can do is this social distancing piece. If you look back historically at cities during 1918 which did social distancing early on in the pandemic and compare the death rate in those cities to cities that didn't bother with the social distancing or did it late, death rate is much lower in the cities with the early social distancing. And that's why this is so critical. It's not that the social distancing is going to stop the pandemic, but it flattens out the epidemiologic curve and thereby reduces the terrific demand on the healthcare system. When the pandemic strikes, we don't know that antivirals are going to be effective because we don't yet know what the virus is going to look like that becomes pandemic. We think it'll be H5N1 perhaps, but maybe not. And even H5N1 is becoming resistant already to Tamiflu. So if it is H5N1, will it be sensitive at the time that the pandemic strikes? We don't know. We really can't depend upon the antivirals being our answer. And how about a vaccine? It's going to take 6 months, probably 4 to 6 months, to have a specific vaccine to the virus that becomes the pandemic virus. So we can't depend upon that. That's the ideal way to prevent viral infections. But we're not going to have it in time. So that part of our armamentarium isn't really going to help us. We're going to be back to basics: social distancing, good hygiene. And the value of this exercise today is to explore 2 things about social distancing, and I would ask you to really focus on these as you go through the rest of the modules. One is, what are the legal authorities out there for doing the social distancing. And I'll tell you that when we did the pilot in Atlanta, and we had a lot of legal resources looking at all the sections of the code, they determined that the authorities were there. The second thing that we have to answer, though, is how about implementing those? What are the difficulties with implementation? And I'll also tell you that the pilot group determined that even though the authority was there, implementation was going to be really tough for a lot of reasons that I think you'll come across as you go through the day. Once again, I appreciate your being here. I think that you'll come out of this feeling perhaps still nervous about pandemic, but also thinking that with concerted effort by good minds across the state, we'll come up with some pretty good answers. Thanks very much.